You've probably heard bits and pieces about the 2026 drug coverage changes in the news, things like drug price negotiations, and it all sounds great. But what does it really mean for you and your specific meds that you take? In this video, we're going to break down exactly what's happening with drug negotiations, which drugs are on that very first list, and what the tweaks to the 2026 deductible and the out-of-pocket caps will mean for your budget. Now, unless you've been living under a rock, I'm sure you've heard about the fantastic $2,000 spending cap on Medicare drug costs that kicked in 2025. But that's just one chapter of the story. Starting in 2026, for the first time in history, the government is going to directly negotiate the price of some of the most expensive prescription drugs on the market. Now, before we jump into the dollars and dates for 2026, I think it helps to take a quick step back and understand the why behind all of this. It can feel like these rules just appear out of thin air, but they actually are a big part of a coordinated plan that's been unfolding for a few years now. All of these updates are thanks to a single piece of legislation called the Inflation Reduction Act, which was signed into law back in 2022. Now that name, Inflation Reduction Act, can be a bit confusing. It was a huge bill covering a lot of ground, but for millions of Americans on Medicare, the biggest impact will be seen on healthcare and prescription drug costs. For decades, everyone has been saying that prescription drugs in the United States are just too expensive, but the government's hands were tied when it came to negotiating better prices for Medicare. The Inflation Reduction Act was designed to finally change that. Its main goal was to directly attack the problem of high drug costs and provide real, tangible financial relief to seniors. This whole thing didn't happen overnight. This law was designed to roll out these changes in phases, year by year, to give the whole system, from insurance companies to pharmacies to you, time to adjust. So we've already lived through the first steps of this plan. It started back in 2023 with a simple but powerful change, making common vaccines like the ones for shingles available at no cost to you. Before that, you might have a hefty copay for those shots, but the law made them free, the first small step in lowering your healthcare expenses. Then came 2024, which brought another major relief, especially for anyone managing diabetes. The law expanded the cap on insulin costs, making sure that no matter what Part D plan you had, your monthly supply of covered insulin would be capped at $35. This was an absolute lifeline for millions. And that brings us to 2025. This year saw what is arguably the biggest change of all: the practical elimination of the dreaded donut hole and the launch of a hard annual cap of a maximum out of pocket for drug spending. For the very first time, you have a real financial safety net. You know that once your spending on your covered drugs hits $2,000 for the year, you pay $0 for the rest of the year. This has been a revolutionary change, giving predictability and peace of mind to people taking expensive medications. So you can see there's a clear pattern here. Each year builds on the last. The changes coming in 2026 aren't random. They're just the next step in this multi-year process. Understanding that context is key. It shows these updates are part of a deliberate strategy to bring your costs down. So when we talk about 2026, don't think it's a disruption, but as a continuation of this positive trend. All right, let's get to the main reason for this video. This is the change that's been talked about for years, and now it's finally happening, and it's Medicare drug price negotiation. So what does that really mean? Negotiation? It sounds good, but the details are what matter to your bank account. For the first time ever, the federal government, specifically the Centers for Medicare and Medicaid Services, or CMS, has the power to sit down with these big drug companies and negotiate the price of certain expensive medications. For years, Medicare was legally forbidden from doing this. It just had to accept the prices set by the pharmaceutical companies, and this new authority completely flips the script. So why is this happening? The why here is really important. The program specifically targets drugs that have been on the market for a long time without any generic or biosimilar competition to bring prices down. These are often brand name drugs used by millions of people on Medicare, and they account for a huge chunk of Medicare spending. Just to give you an idea, in 2022, around 9 million people on Medicare spent over $3.4 billion out of pocket on just the first 10 drugs selected for this program. By negotiating a lower price, the goal is to save money for the entire Medicare program, which keeps it strong for the future, and most importantly, to pass those savings directly on to you. Here's how it works in simple terms. CMS identifies Part D drugs with the highest spending that's been on the market for years without competition. For this first round, they picked 10 drugs. Then CMS goes into a negotiation with the manufacturers to land on a maximum fair price. Once that price is set, it becomes the new lower baseline price that all the Part D plans will use for the drug starting in 2026. This is a really big deal. So you're probably asking, which drugs are on the list? Let's run through them. Think about whether you or anyone you know takes one of these drugs. The first 10 drugs are listed above. You've got Eliquis, which is a very common blood thinner used to prevent strokes and blood clots. You've got Jardiance, used for type 2 diabetes and to reduce cardiovascular risk for people with heart failure. You've got Xarelto, you've got Januvia, Farxiga, Entresto, Enbrel, and the list goes on and on. Now, this program is just getting started. After these 10 drugs in 2026, CMS will negotiate prices for another 15 Part D drugs for 2027 and 15 more for 2028, which will include some Part B drugs for the first time ever. So what does this actually mean for you? Let's imagine two scenarios. First, what if you take one of these 10 drugs? The answer is simple and it's great news. Starting in 2026, your cost for that medication, your copay or coinsurance will be based on this new lower maximum fair price. For example, let's say a drug on this list has a price of $500 a month. If your plan is a 25% coinsurance, you are paying $125. But if the new negotiated price is set at $300, your 25% is now calculated from that lower number. So your new cost would be $75. That's $50 in savings every single month you pick up that medication. So your exact savings will depend on the drug and the final price, but the idea is the same. Your costs for these specific drugs are set to go down. Now, what if you don't take any of these 10 drugs? Does this still help you? Yes, it can in a broader way. When the overall cost of these super expensive drugs go down for the whole system, it helps control the growth of Part D plan costs. Over the long term, this can have a stabilizing effect on premiums for everybody. It's a key piece of the puzzle to make the system more affordable for all. Now, beyond the exciting drug negotiations, there are a couple of other important adjustments to the structure of Part D plans for 2026, and these are the changes to the numbers that you see every year, like your deductible and that out-of-pocket cap. Let's walk through them so you know exactly what to expect. First up is the Medicare Part D deductible. This is the amount you pay for certain drugs before your plan starts to chip in. For 2026, the standard Medicare Part D deductible is projected to be about $590. This is the same as the 2025 deductible. Now let's move on to the second and arguably more important number for 2026, and that's the annual out-of-pocket cap. As we talked about, getting a real hard cap on spending in 2025 was a game changer. It created a financial safety net that never existed before. This cap means that there's an absolute limit to what you'll have to spend on your covered drugs in a given year. Once you hit it, you pay zero for the rest of the year. This protection is the new foundation of Part D programs. For 2026, the annual out-of-pocket cap for Part D drugs will be about $2,100. So it's great news that this cap will still be in effect in 2026. Before 2025, there was really no limit. People could spend $5,000, $8,000, or even $10,000 or more per year on their medications. The change from that old system to a hard cap of $2,000 or $2,100 is a massive improvement that protects you from all types of out-of-pocket costs. Now let's walk through a quick example of how all this will work in 2026 using the new numbers. Let's imagine a beneficiary named Carol. At the start of 2026, Carol's going to pay 100% of her drug cost until she meets her plan's deductible, as long as those drugs apply to that deductible. Let's say the standard deductible is $590, and it's important to note that not all medications actually apply to that deductible. But once Carol meets her deductible, her plan's cost sharing kicks in. She'll now pay a steady 25% coinsurance for her covered drugs. The plan and the drug manufacturer then will cover the other 75%. The $590 deductible she paid plus every 25% coinsurance payment she makes is added up. Once the total amount she has personally paid in hits $2,000 for the year, everything changes. The moment Carol's spending hits that $2,000, she enters the catastrophic phase. From that point on for the rest of the year, her cost for all her covered Part D drugs is $0. A refill in November costs her nothing. Another in December, still nothing. And it's important to know that this cap resets on January 1st. So it's a given that in 2026, if they project that to be about $2,100, those will be up to $2,100 instead of $2,000. Now we've covered drug negotiation and the out-of-pocket numbers, but there's one more piece of the puzzle that hits your monthly budget, your Part D premium. So what should we expect there? This is a bit more complex since your premium always depends on the specific plan you choose. However, the Inflation Reduction Act included a program to keep premiums from spiking because all of these big benefit changes. Essentially, the government has been helping insurance plans absorb some of the new costs to keep premium increases manageable for you. And this program will continue for 2026, but the law allows premiums to rise a bit more than in the previous years. What does that mean for you in simple terms? It means there's a potential for your monthly Part D premium to go up in 2026. This doesn't mean your premium will definitely skyrocket, but it makes one thing crystal clear. It's more important than ever to review your plan in open enrollment, October 15th through December 7th. Now you have to compare your options for the upcoming year during that time. A plan that was a great deal in 2025 might not be the best one for you in 2026. You have to look at the premium, the deductible, and especially the formulary, which is the list of covered drugs, to make sure that all your medications are included at a good price. Now, while we're on the topic of costs, let's quickly hit two very positive points that are continuing in 2026. First, the confusing coverage gap phase, often called the donut hole, is gone for good. Thanks to the new design, once you're past your deductible, you just pay a simple 25% coinsurance until you hit that $2,000 cap. You no longer have to worry about that complicated phase where your cost used to suddenly jump up and it appeared to be for no reason. Second, the $35 monthly cap for a 1-month supply of covered insulin is also here to stay. In fact, the rule gets even better in 2026. For insulins that are part of the negotiation program, your cost will be the lesser of either $35 or 25% of the new lowered negotiated price. This ensures people with diabetes continue to have affordable access to life-saving medicine. So when we look at the whole picture for 2026, we see a few moving parts. Drug negotiation is set to lower costs for key drugs, the out-of-pocket cap holds strong, and the premiums might see some pressure to go up. This combination leads to the most important takeaway of all. We've gone over a ton of information. The simple, most important thing I can tell you is this: you must review your Medicare Part D plan every single year during the fall open enrollment period. This open enrollment period runs from October 15th through December 7th. I really can't stress that enough. With all these changes, the plan that was perfect for you this year might be the wrong one for next year. Insurance companies change their plans every year: the premium, the deductible, and the list of covered drugs that they accept. Now, drug negotiation adds a new wrinkle. As prices for those 10 drugs come down, plans might adjust how they cover other drugs. A plan might make a non-negotiated drug more expensive to nudge people towards the newer option. And if that's the drug you're currently taking, you could have a really bad surprise if you're not paying attention. Your own health needs can also change. The only way to be sure you have the most cost-effective coverage for the specific medications that you take is to do an annual review. We know this is a lot, and figuring out how it all affects your personal situation can be overwhelming. That's what we're here for. Our team of licensed independent agents specializing in Medicare do it all for you, and it's all we do. We can help you make sense of these changes, compare the plans in your area, and find the one that fits your needs and budget. And our guidance comes at no cost to you. We're here to be a resource, to bring clarity, and to help you feel confident in your choices. So you can book a free, no obligation chat with us by clicking the link in the comment section or by calling the number on the screen. And there's no pressure, just straightforward help from people who understand it. Now, if you found this video helpful, I'd greatly appreciate it if you hit the like button and the subscribe button and you turn the notification bell on so that you don't miss any important Medicare updates moving into open enrollment. I appreciate you watching our video. Thank you so much for supporting our channel, and go check out this new video where we go over the 2026 price updates. I'll see you over there.